अभिनंदन। नेशनल लेवल ऑनलाइन लेक्चर सीरीज के 31वें सत्र में आप सभी का स्वागत है। दिस लेक्चर सीरीज इज ऑर्गेनाइज्ड बाय आरोग्य भारती, पश्चिम महाराष्ट्र प्रांतस भारतीय स्वास्थ्य चिंतनायाम इन एसोसिएशन विद भागीरथी मेडिकल फाउंडेशन। आज का यह विशेष सत्र आयुर्वेद के अत्यंत महत्वपूर्ण विषय क्लिनिकल सिग्निफिकेंस ऑफ क्रियाकल्प एज अ फ्रेमवर्क फॉर टाइमली थेरापेटिक इंटरवेंशन पर आधारित है। लेक्चर का शुभारंभ हम भगवान श्री धन्वंतरी स्तवन से करेंगे। नमामि धन्वन्तरिमादिदेवं सुरासुरैर्वन्दितपादपद्मं लोके जरारु भयमृत्युनाशनं धातारमीशं विविधौषधीनाम् शङ्खं चक्रं जलौकां ददतमृतघटं चारुदौर्भिः चतुर्भिः सूक्ष्मस्वच्छातिरुद्यान् शुकपरिविलसन् मौलिमम्भोजनेत्रं कालाम्भोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदावादा प्रौढदावाग्निलीलं शङ्खचक्रजलौका। धन्यवाद। The divine vibrations of Lord Dhanvantari's blessing truly set the perfect tone for today's academic gathering. आज के हमारे कार्यक्रम के उद्घाटन एवं मार्गदर्शन करेंगे डॉक्टर टी.एन. मंजुनाथ जी। इनका परिचय करने के लिए मैं आमंत्रित करती हूँ डॉक्टर मनोज चौधरी सर जी को। सर इज वर्किंग एज एसोसिएट प्रोफेसर एंड एचओडी इन अष्टांग आयुर्वेद कॉलेज पुणे. सर इज ऑल्सो वर्किंग एज प्रमुख इन भारतीय स्वास्थ्य चिंतन आयाम. काइंडली म्यूट योर माइक्रोफोन्स मैडम. Ashtanga Ayurveda College Pune, and sir is also working as Pramukh in Bharatiya Swasthya Chintanayam of Arogya Bharati, Paschim Maharashtra Pranta. Over to you, sir.
नमस्कार. आदरणीय डॉक्टर टी.एन. मंजुनाथ जी का परिचय करने का मुझे सौभाग्य प्राप्त हुआ है. नमस्कार सर, स्वागत. डॉक्टर मंजुनाथ जी मूलतः आयुर्वेदाचार्य एवं योगाचार्य है. इनका केंद्र मैसूर है. पिछले 40 साल से आप देश विदेशों में आयुर्वेद का प्रचार और प्रसार बहुत आत्मीय और जोर शोर से कर रहे हैं. 43 से ज़्यादा अनेक राष्ट्रीय अंतर्राष्ट्रीय समावेशन में आपके प्रबंध की प्रस्तुति हो चुकी है और जिनसे बहुत सारे जो स्कॉलर्स हैं वो प्रेरणा लेते हैं और लाभ भी लेते हैं. अनेकों आयुर्वेद के लेख, विशेषतः योगाचार्य होने की वजह से अष्टांग योग पर भी आपका काफ़ी महत्वपूर्ण योगदान रहा है, मार्गदर्शन रहा है. आप आरोग्य भारती के संस्थापक न्यासी भी है और राष्ट्रीय सचिव भी आप हैं. तो आदरणीय मंजुनाथ जी को मैं विनम्रतापूर्वक निवेदन करता हूं कि हमें मार्गदर्शन करें और सत्र की घोषणा, उद्घाटन की घोषणा करें. धन्यवाद.
धन्यवाद. आरोग्य भारती का पश्चिम महाराष्ट्र प्रांत के आयुर्वेद अभ्यासनम, इसमें भाग लेते हुए मुझे बहुत खुशी मिलता है, मुझे बहुत संतोष होता है. ये पूरे राष्ट्रीय स्तर का एक ऑनलाइन कार्यक्रम है. राष्ट्रीय स्तर से विद्यार्थियां जुड़े हैं. आयुर्वेद जो है नित्य नूतन है. कहते हैं आयुर्वेद का जो उगम जो है 2000 या 2500 साल पहले हुआ है, मगर आज भी प्रस्तुत है और आगे भी प्रस्तुत है. It was there, it is there, and it's going to be there for another thousands of years. आयुर्वेद का आज कल पूरे विश्व में इसका काफ़ी बहुत ही इसका डिमांड है और उसका भविष्य भी बहुत ही उज्जवल है. तो जितने भी स्वास्थ्य के क्षेत्र में जो क्लिनिशियन, जो क्लास, जितने भी स्वास्थ्य विज्ञान है, उसमें आयुर्वेद बहुत ही एक अहम विज्ञान है। तो आयुर्वेद का जो सिद्धांत है वो कभी भी पुराना नहीं होगा। जैसे कल मैं बात करते हुए मैं सोचा था, निघंटुना विना वैद्यो विद्वान व्याकरणम विना अनभ्यासेन धानुष्को त्रयोहास्यस्य भाजनम। निघंटु मतलब जो एक आयुर्वेद वैद्य है, निघंटु के ज्ञान के बिना, मतलब उसका जो द्रव्य गुण के ज्ञान के बिना, और आज का जो विषय है क्रियाकाल, जो क्रियाकाल में अगर हम पंचमहाभूत का सिद्धांत और त्रिदोंत का सिद्धांत को ठीक नहीं समझे तो आयुर्वेद का जो चिकित्सा बहुत ही मुश्किल है या नामुमकिन है। इसलिए आयुर्वेद का जो सिद्धांत पर हम ज्यादा जोर देना बहुत ही जरूरी है आजकल। आयुर्वेद का जो मूलिकाएं हैं विदेशों में शायद मिल नहीं सकता, मगर सिद्धांत तो हम वहां पे अप्लाई कर सकते हैं। जैसे मैं एक उदाहरण के तौर पे देता हूं, रोगा सर्वेपि मंदेग्नौ, सभी बीमारी का कारण है मंद अग्नि। ये सिद्धांत तो कहीं पर लागू होता है, या भारत हो या अमेरिका हो जापान हो, जो कहीं पर भी हो, सिद्धांतों का प्रयोग हम अवश्य कर सकते हैं। तो हम चिकित्सा के साथ साथ आयुर्वेद का जो खास जो है स्वस्थ वृत्त, खासकर दो दिनचर्या है, और जो स्वस्थ का जो लक्षण दिया है सुश्रुत आचार्य ने, वो कहीं पर अगर आप कहेंगे तो इतना सुंदर व्याख्या है, इतना सुंदर व्याख्या और कोई भी शास्त्र में आपको नहीं मिलता। ये आयुर्वेद का बहुत ही यूनिकनेस है जहाँ पे स्वस्थ का लक्षण दिया है। इसलिए इतने सारे जो सिद्धांत के ऊपर हमें चिकित्सा के साथ साथ थोड़ा प्रिवेंटिव और प्रमोटिव, उसके बाद चिकित्सा, जो कहते हैं स्वस्थ से स्वास्थ्य रक्षणम, स्वस्थ व्यक्ति का स्वास्थ्य रक्षण करना हमारा पहला कर्तव्य है, उसके बाद होता है चिकित्सा। इसलिए हमारी चिकित्सा से पहले जो आयुर्वेद में कहा गया है, जो बहुत सारे सिद्धांत हैं, ये त्रिदोष सिद्धांत, उसके ऊपर हमें बहुत ही अहम इंपॉर्टेंस देना चाहिए। और उसका सिद्धांत को एक बार हम पकड़ेंगे, कोई भी बीमारी का नया अगर नाम आया उसके बारे में हमें सोचने की आवश्यकता नहीं है, नहीं नहीं आयुर्वेद में डिसीज कहाँ गया है, नहीं कहा है, क्या करें। हम सिद्धांत के आधार पर, त्रिदोष के आधार पर उसका चिकित्सा कर सकते हैं। हमें एक नया डिसीज किसी ने कहा, नहीं नया डिसीज आयुर्वेद में नहीं कहा गया, उसका उल्लेख नहीं है, उल्लेख की जरूर आवश्यकता नहीं है। त्रिदोष के आधार पर हम इस बीमारी का चिकित्सा या रोग निदान कर सकते हैं। इसलिए मेरा कहना बहुत ही यहाँ पे उचित होगा, आप चिकित्सा के साथ साथ उसका जो पूरे जो दिनचर्या, स्वस्थ और ऋतुचर्या, और निघंटु तो बहुत ही अहम है। निघंटु के बिना कोई वैद्य पूरा नहीं होगा, वो हास्य के कारण हो जाएंगे, दे बिकम द लाफिंग स्टॉक। और त्रिदोष तो पूरा उसको पूरा करगत कराना पड़ेगा हमें। त्रिदोष का लक्षण, गुण का स्थान, उसका क्रिया, वृद्धि, क्षय, ये सब जो है हमें बहुत ही अच्छी तरह से समझना चाहिए, ताकि कोई त्रुटि ना आए हमारे डायग्नोसिस में, रोग निदान में और उसकी चिकित्सा में। मैं इतना ही कहकर अपना वाणी को विराम देता हूं। तो आज का जो सत्र प्रारंभ करने के लिए मैं सबको स्वागत करता हूं। और आज का सत्र जो है क्लिनिकल सिग्निफिकेंस ऑफ क्रियाकाला, इसको चिकित्सा में इसका महत्व क्या है, तो उसको हम आगे बढ़ाएंगे। डॉक्टर रोशनी से हम निवेदन करते हैं।
Thank you, Dr. Manoj Chaudhary Sirji, for graceful introduction, and thank you, Manjunath Sirji, for your motivating words. अब हम आज के मुख्य वक्ता रूप में हमें उपलब्ध हुए हैं डॉक्टर रोशनी केपी मैडम। ये हमारा सौभाग्य है कि मैडम का इतना सिग्निफिकेंट रिसर्च और पब्लिकेशन इम्पैक्ट है और वही आज हमें वक्ता स्वरूप में अवगत हुए हैं। मैडम इज करंटली वर्किंग एज प्रोफेसर एंड एचओडी क्रियाचार्य डिपार्टमेंट। Madam has a great contribution in the field of Ayurveda. Madam also has received many awards during her BMS and post graduation and during the academic career. Madam has secured highest mark in final BMS. She has served as a resource person in more than 15 national and international conferences. Madam has greatly contributed in research with more than 10 paper presentations in national and international conferences. Madam has published more than 35 articles in high impact national and international journals. She has also published one book on adolescence and she has attended 50 plus seminars and workshops. Madam holds a great academic and research record. So we welcome Madam and we invite her to kindly deliver her lecture. Thank you, Madam.
Thank you, ma'am. Am I audible?
Yes, ma'am.
Can I start, ma'am?
Yes, ma'am. Please start.
Namaste all. Sri Dhanvantare Namaha. Myself, Dr. Roshni, Professor and HOD of Kriyasharira Department from Sri Jayendra Saraswathi Ayurveda College, Chennai. So, first of all, I would like to thank all the higher officials of Arogya Bharati platform for giving me such a wonderful opportunity to present my inputs on the topic clinical significance of Kriyakala as a framework for timely therapeutic intervention. So, Arogya Bharati officials have told me to select the topic actually. So, why I selected this particular topic because this Kriya Kala, this has been taught starting from the first professional to the third professional as per NCSM syllabus. If you see the syllabus of NCSM, you can see the concept of Kriya Kala in first professional syllabus, second professional and third professional syllabus. So because of this relevance or because of this importance, I thought I will select this particular topic. So these are the contents which I am going to explain in today's presentation. Introduction, definition, types of Kriyakala, Vyadhi Kriyakala, importance of Kriyakala, Ritu Kriyakala, and correlation of the concepts of Kriyakala with modern science, and in particular diseases, how we can explain the Shad Kriyakala. So these are the contents for today's topic. So to start the presentation, first of all, in class also, all the teachers will start any new topic with derivation or nirukti. So here also, if you see the term Kriya Kala, that is formed by the union of two words, Kriya and Kala. Uh, Actually, in Sanskrit, any new terminology, Sanskrit terminology, in different occasions or different contexts, a single word will be having different meanings. So we have to choose the meaning as per the context where that particular term is used. Usually for kriya, always we can give the meaning as karma or action, and kala always denotes time or samayam. So if you join these two words kriya and kala, that itself indicates some importance for the action, and here this action denotes nothing but the chigilsa only. So actually Dalhana, who is the commentator of Susruta Samhita, he explains Kriyakala as Adyaha Karma Avasara for karma, that is explained as Kriyakala. That means opportunity. Avasara means opportunity for doing any type of karma or any type of therapeutic uh, procedures. So that is explained as karma avasara. And in Ayurveda Shabdakosha, which is an important dictionary, what students can refer for new terminology, for getting the meanings of new terminologies, there it is mentioned that Kriyakalaha, Chigilsa Kalaha. That means these Kriyakalas are the appropriate time explained for providing any type of treatment protocols or therapeutic measures. So, Kriya or action refers to the measures taken in the form of Aushadha, Ahara, and Vihara with an aim to correct the doshic disturbances. We very well know our treatment protocols are strongly based on the Ahara, Aushadha, and Vihara. These 3 points should be taken very well into account for correcting any type of dosha dushtis. So, Kriya or action here refers to any type of such actions which will be in the context of Aushadha, Ahara, and Vihara. So this topic is having very much important role in the early diagnosis, prognosis, and for adapting preventive and curative measures in any type of diseases. So any physician who very well know the Kriyakala concept, he can easily do the early diagnosis of disease, and he can do the prognosis, and he can adopt the preventive and curative measures also. So this refers to the recognition of the stage of disease prognosis and the appropriate time of treatment. And Kriyakala, you can see both Susruta and Vagbada, both Acharyas have explained the concept of Kriyakala very well. Whereas Acharya Vagbada explains Kriyakala under 3 headings, Chaya, Pragopa, and Prashama, whereas Susruta explains it as Shat Kriyakala, and this explanation or reference we can see in Vrana Prashniya Adhyaya of Susruta Samhita. So we very well know, as Manjunath sir told, without the involvement of Vada, Pitta, and Kapha, any disease or no disease can be explained in our science. So any physician, without knowing the concept of tridoshas, and tridoshas are nothing but the conglomeration of Panchabhutas only. We very well know Vayu, Agasha, Dhadubhyam, Vayuhu, Agneyam, Pittam, Ambaha, Prithvibhyam, Sleshma. So Tridoshas are nothing but Panchabhutas only. So without knowing the involvement of Vada, Pitta, Kapha, we cannot explain any disease. So aggravation of these doshas become the root cause for all the diseases. So any symptoms can be categorized under Vada, Pitta, Kapha. If any pain is there, obviously without Vada, Rujo Nasti, Vada. Without the involvement of Vada, Ruja will not happen. Pitta, Daha, and Kapha, Gauravam or Kandu. So any treatment required for any type of disease must should be corresponding with the dosha imbalance. So the doshas should be pacified properly, then only we can the treatment protocol also will become successful. So the concept of Kriyakala that has been widely described in 2 separate entities, which are nothing but Rudu Kriyakala and Vyadhi Kriyakala. So Ritu Kriyakala, actually, as we know, it is considered under normal physiological variations of dosha in respective seasons. That already we know, as per Ashtanga Hridayaka, Vagbada is explaining Chaya Pragoba Prashamaha, Vayor Grishmadishu Trishu, Varshadishu cha Pittasya Sleshmanaha Shishiradishu. He very well explained physiologically itself when Vada is undergoing Chaya, Pragopa, and Prashama. That we will come later in the coming presentation. So, for example, Vada will be undergoing Chaya in Grishma, next Ritu. Varsha Ridu it will be undergoing Pragoba, and next Ridu it will be undergoing Prashama. So this come under Ridu Kriyakala. Physiologically itself doshas will be having variations. So this is a pictorial representation, Vyadhi Kriyakala and Ridu Kriyakala. So Vyadhi Kriyakala is the process of understanding the pathogenesis of disease in consecutive stages, and it is also known as Shad Kriyakala, because Susruta, as he is Shalya Tantra Pradhana Vidagdan, he has, while explaining the Vrana Chigilsa, each stage of Vrana can be easily identified if we know the Shadkriya Kalas properly, and we can plan the treatment protocols very well. So Vyadhi Kriya Kala is meant for understanding the pathogenesis of the disease. So these are nothing but Sanjaya, Pragoba, Prasara, Sthana Samsraya, Vyakti and Bheda. So among these 6 Kriya Kalas, the initial 3 stages, that is Sanjaya, Pragoba and Prasara, can be considered as preclinical stage of any disease, because there we know, we will discuss later, there the clinical symptoms or the symptoms will not be manifested fully, or they will not be that much clear. So they are considered, Sanjaya, Pragoba and Prasara, they are considered as the preclinical stages, whereas the last 3, Vyakti, Sthana Samsraya, Vyakti and Bheda, they are clinical. And among that, Sthana Samsraya is nothing but the Purva Rupa Avastha also. So actually we have a concept that the increased dosha, vruddha doshas are more capable of generating a disease, rather than the kshina doshas. Increased doshas are more capable of creating a disease, but dosha kshaya also can be considered as a kriya kala as per Susruta. So coming to the first Kriya Kala, that is Sanjaya, that is a stage of accumulation. So first we will discuss about the Vyadhi Kriya Kala, later Rudu Kriya Kala. So in this stage what will happen? Accumulation of doshas will happen in its own sites, natural sites. We know very well for Vada, Pakwa, Sheha, Kadi, Sakti, Srotrasti, Sparshanendriyam, Vadasya. Like that for Pitta also, Nabhirama, Shio, Sedo, Lesiga, Kaba also, particular natural sites are explained. So if the doshas are accumulated in these particular, for Vada, the Visheshasthana is Pakvashya. For Pitta, Nabhi is the Visheshasthana. And for Kaba, Uras is considered as the Visheshasthana. So, if the doshas are accumulated, not that much increased, it is the accumulation. That is why Acharya Vagbhada is explaining Chaya. He is explaining as Chaya as Chayo Vriddhihi Swadhamnyeva. That means Dhamam means its own seed. Its own seed, if the doshas are getting accumulated, that is considered as Sanjaya. And it is the first Kriyakala, first stage of Kriyakala according to Susruta. So this is the early stage where we can plan for suitable preventive measures. So how to differentiate between Chaya and Sanjaya? For that, Dalhana, commentator of Susruta, is giving a very good explanation. That is Samhadi Rupa Vriddhihi Chayaha. That means in a consolidated form, the Vriddhi or increase is happening. That is called as Chaya. So here what will happen? Doshas will increase quantitatively only, but their quality remains normal. And it is very difficult to identify. A well experienced physician only can understand the symptoms in the Chaya Avastha, because their quantitatively only the doshas will be increasing, but the quality, for example, for Vada, the qualities or gunas are Tatra Ruksha, Laghushita, Khara Sushma, Chalo, Anilaha. So in these qualities will not be increasing that much, or it will remain normal, but quantitatively these doshas start increasing or accumulating. So vague or ill-defined symptoms will be characterized. So it is very difficult to identify the disease or the stage of Sanjaya. So what will happen according to Vagbada? What he is explaining is chayo vriddhihi swadhamnyeva pradvesho vriddhihedushu. That means he will be the person or patient or that particular person will be having aversion for similar qualities and attraction towards opposite qualities. So if vada chaya is happening, he will be having aversion to the own qualities of vada. So like that we have to understand now the dosha, vada dosha is going to accumulate. So it is, that is why I'm telling it is difficult to understand the chaya of doshas in Sanjaya Avastha. So according to Susruda, two types of Sanjaya is explained, Swabhavika and Aswabhavika. So Swabhavika chaya is again divided into two, Avastigi and Naimitigi. Avastigi is that is nothing but according to age. We very well know doshas which age group or which period of time each dosha is having its own predominance. That is explained. Vayo ahoratri bhuktanam te andamadhyadigaha kramat. So vayo, vayas, or in the lifespan, which stage? In the early stage, there will be predominance, or it can be explained as chaya, sanjaya of kaba. In middle age, there will be the Sanjaya for Pitta, and in the Vardhakya Avastha there will be the Sanjaya for Vada. So this concept is considered as the Avastigi type of Swabhavika Sanjaya. Whereas Naimitigi type of Sanjaya, which is coming under Swabhavika, that is according to Rudu. That already I have told, Chaya Pragoba, each Rudu which doshas will be having Sanjaya. Chaya Pragoba Prashamaha, Vayor Grishma Dishu, for Vada, Grishma Rudu, Pittam, Varshadishu cha Pittasya, for Pitta in Varsha Rudu, normal, Naimitiki type of Sanjaya will be happening, and Sleshmanaha Shishiradishu, for Kaba in Shishira Rudu, Naimitiki type of Sanjaya will be happening. So coming to the causes of dosha sanjaya, always doshas when it will be vitiated, that we know. For each dosha, the pragoba karanas are explained in Ashtanga Hridaya Nidhanasthana. For example, for Vada, तिक्तोषण कषाय अल्परूक्ष प्रमिद भोजनैः धारण उदीरण निशा जागरण अत्युच्च भाषणैः क्रियादियोग भीषोग चिंदा व्यायाम मैथुनैः ग्रीष्म अहोरात्रि भुक्तान्ते प्रगुप्यति समीरणः. So in that, under different categories, that means under the category of ahara, particular rasa predominant ahara if you are taking, there will be the pragoba or sanjaya for vada. That means if the person is continuously taking tiktarasa, ushana rasa, that is kadurasa, and kashaya rasa, the vada chaya will be happening. So these characters can be considered under improper diet, where I have told three reasons: disturbed lifestyle, genetic predisposition, another one psychological factors, and improper diet. So if the patient is taking more tikta, ushana, and kashaya rasa predominant food, chances of vada chaya is there. That is coming under improper diet. Then dharana, udirana, nisha jagarana, that is disturbed lifestyle. If the patient is always doing the vega dharana or udiranam, forceful evacuation of vegas, 13 vegas are told, no, if it is happening, these all will come under the disturbed style causes. And if Atticha Bharshanam, if always the person is talking in high voice, always disturbed mind, they all these causes will be coming under psychological factors. So these three are the main reasons for the causes of dosha sanjaya. Like that for pitta and kapha also the causes are explained. So dosha is going to accumulate in their respective seats, and the causes for accumulation is told somewhere in the Samhitas. So accumulated dosha manifests these symptoms. For example, if the Vada dosha is undergoing chaya, main symptoms, clinical features are stabdha purna koshtada. Always you will feel the fullness of stomach. On the other hand, if pitta is going to undergo chaya, there will be pidava bhasada, there will be yellowish discoloration all over the sharira, and mandoshmada, normal body temperature will be reduced. And if the kaba is going to be undergoing chaya, there will be anganam gauravam. You may feel heaviness for your body, and alasyam. You will not be having the desire to do any type of work. So these are the clinical features in Sanjaya Avastha. And in Ashtanga Hridaya, Vagbhada is explaining what is the importance of management in the stage of Sanjaya. Because I told you, it is very difficult to find out the doshas in Sanjaya Avastha, because clear-cut symptoms will not be manifested. You cannot see the clear-cut clinical features. So well experienced Vaidya only can identify because of the with the following previously explained symptoms. So if he understands that, it is better to start the treatment protocol, or else you can do the treatment without giving the medicines. If you correct the lifestyle and food style, that is very well enough to prevent the dosha without going into the pragoba avastha. That is why Vagbhada is explaining chaya eva jaye dosha. It is always better to conquer the doshas in sanjaya avastha itself. Whereas Susruta is opining that when the dosha is most powerful, is managed by Shodhana or Shamana protocol, then the next powerful dosha will be defenseless. So it will automatically return to normalcy. So most powerful dosha should be managed by either Shodhana or Shamana. Then the weak doshas will subside automatically. Coming to Pragoba Avastha, that is a stage of aggravation. Sanjaya was a stage of accumulation. So here, if we are not treating the doshas in the Sanjaya Avastha, because sometimes physician also will neglect those stages, and the patient also will not approach the physician with any particular type of symptoms, because he also may not identify. So the doshas will go to the next Kriyakala, that is Pragoba. So this is also explained by Dalhana, commentator of Susruta Samhita. Accumulated dosha moving to other sides than its main side, that is considered as Pragoba. This is explained as Kobastu Unmargagamida by Susruta also. Unmargagamida means going to different sides. So this will happen if it is not properly treated in Sanjaya. So this is told as how we have seen Chaya, Sanjaya as Samhadi Rupa Vriddhihi. Here Pragoba Avastha is explained as Vilayana Rupa Vriddhihi Pragobaha by Dalhanacharya. That is somewhat dissoluted stage or liquefaction stage of increased doshas, that is explained as Pragoba by Dalhana. So here doshas gets quantitatively vitiated and they are ready to move from their natural sites by appropriate etiological factors, and this is the second stage of Kriyakala. Here Pragoba, different classifications are told by different commentators of Susruta Samhita. Like on the basis of nature of disease, there are two types of Pragoba. One is Nija and the another one. This is actually the classification of disease also. In Nija type of Pragopa, uh, Chaya followed by Pragopa is the rule actually. Whereas in Agantuja type of Pragopa, diseases, type of diseases, Dosha Koba directly occurs without Chaya. So these are the two types. Whereas Hemadri, another commentator for Ashtanga Hridaya, he explains two types of Pragopa like Prakriti Sama Samaveda and Vikriti Vishama Samaveda. These two terminologies are very much familiar in Drivyaguna Vijnana also, where if the action of two particular Dravya combination does not match with their gunas, that is coming under Vikriti Vishama Samaveda. Whereas the actions of two drugs are coinciding with their gunas, that is coming under Prakriti Sama Samaveda. So here also the same concept we can explain. Under Prakriti Sama Samaveda, the disease presentation will be identical to the doshas involved. Whereas in Vikriti Vishama Samaveda, the disease presentation will not be identical. So if you consider the Pragopa Lakshanas in Vada, for Vada, it is explained as Tesham Pragopat Koshtatoda Sanjarana Amlika Pipasa Paridaha Annadveshascha Pragopa Lakshanaha. Like that, Susruta is explaining. That means for Vada, Koshtatoda Sanjaranam, there will be painful sensation in Mahasrodhas, and Vada moves to different places other than its own seats. Whereas for Pitta, if it is undergoing Pragopa, sucking type of pain will be there, Daha, burning sensation, and Dhumayanam from the mouth, Asya. These are the Lakshanas. Whereas if Kaba is undergoing Pragopa, there will be Aruji, Agnimandya, and Vamana. These Lakshanas are told by Susruta. So dosha is going to accumulate in their respective seats, and causes for accumulation of dosha is described in other areas of Samhita. So for Vada, Koshtatoda, Vada Sanjara, and what I have explained, Koshtatoda Sanjarana, Amliga Pibasa for Pitta, and Aruji Lala Srava for Kaba are the Lakshanas. Coming to third Kriyakala, which is the Prasaravastha. This is complete spreading of, it's a stage of spread actually. So this is, the derivation is nothing but Deshandara Saranam Iva Prasara. That is told by Dalhana. From one Desha to another Desha, Saranam of doshas will happen. This is nothing but the overflowing of doshas from their respective seats to other places. Like how the fermented materials coming out. If we keep the rice dough in a vessel, obviously the next day, if you are not keeping it inside the refrigerator, it will come out. So that coming out or overflow of the fermented materials, to that we can compare the prasaravastha. Okay, so for this prasara, always Vada is the responsible factor. Causative factors for all these, because we know very well Vada is having the property of Chalana. So, and it is Yogavahi also. This will try to drag other factors also. So, this is considered as the causative factor for the spreading of disease. How the flowing water can take any direction, like that Vada will be taking everything. So Vagbada doesn't explain about Prasara, because he explains only three Kriyakala, Chaya, Pragopa and Prashama. It is Prashama, not Prasara. It is specifying. But the status of a stage in the evolution of disease, he explains the causative factors for the transit of doshas from Koshta to Shaga, Asti and Marmas. These are the Trivida Yoga Margas. So while explaining about Yoga Margas, he explains how the doshas will be moving from one koshta to shagha, asti and marmas. For that, he is explaining some reasons also, like vyayamad, ushana, taishnyad, ahida, jaranadabi, कोष्ठात् शाघास्ति मर्माणि धृतत्वान् मारुदस्य च दोषा यान्ति तथा तेभ्यः श्रोतोमुखविशोधनात्. Like that, reference is there in Ashtanga Hridaya. That means vyayamad ushana taishnya, because of over exercise vyayama, then intake of more, or because of influence of hot substances, or ahita jaranam, any type of ahita ahara or vihara intake, there are chances of doshas moving from koshta to shaga, asti and marma. The same reverse also will happen, that is the doshas may revert back to koshta from shaga, asti and marma because of srodho mugha vishodhana, like that. For that also reasons are told. So even though Bhagbada is not explaining prasara, he explains the movement of doshas from one particular area to other areas. So this is explained under 15 types actually. Vada, Pitta, Kaba, Rekta, then Dvandvaja doshas, Vada, Pitta, Vada, Kaba, Pitta, Kaba. Like that, 15 types of antradoshas, Vada, Pitta, Rekta, Prasara. Vada, Kaba, Rekta, Prasara. Like that, 15 prasaras are explained. So these are the lakshanas when the doshas, Vada or Pitta or Kaba, are undergoing prasara. For Vada, Vimarga Gamanam Adobam, and for Pitta, Osha, Chosha, Paridaha, Dhumayanam. And for Kaba, Aruji, Avipaga and Chardi. This is explained by Susruta, like Evam Pragubidanam Prasaradam Vayor Vimargagamanam Atobau Osha Chosha Paridaha Dhumayanani Pittasya Arojaga Avipaga Anga Sadas Chardischedi Sleshmano Lingani Bhavandi. Like that, in Sutrasthana, Acharya Susruta is explaining the lakshanas. So if these lakshanas are there, obviously we can consider particular doshas are in prasaravastha. And Susruta further details the modus of operandi of doshas affecting various diseases throughout the whole body. Even dosha aggravation is sometimes, doshas may be in maximum vruddhavastha, but then also disease may not happen. That is because of the non-cooperation of other factors like Agni, Srodhas. If they are in good condition, sometimes disease will not manifest. So here example is given, common example, where how we can identify the stage of prakopa and prasara, because always students will think both are same, prakopa and prasara. So how we should understand this? If you heat thick ghee, solid ghee, it start melting, no, that is considered as prakopa stage. Whereas if you again heat the melted ghee, there will be the evolution of froth, and this froth which is evolved, this will be reaching the top of the utensil. So that is considered as prasaravastha. So these two pictures are given here. So this with uh, keeping these two pictures in your mind, you can very well identify the prakopa and prasaravastha. Obviously, with the help of symptoms, we can easily identify. This is the fourth Kriyakala, that is the stage of localization, which is explained as Dehaiga Deshasrayanam Sthana Samsrayanam Viduhu. So the agitated doshas spreads to different places, and somewhere it will be stuck. Mainly in the weak srodhas, any srodhas which is having some dushti or vitiation, there are the chances of getting these doshas which are doing prasara in different areas. So this stage is called as Thana Samsraya Avastha. So at this site, when the dosha dusha sammursana takes place, diseases occur. So in this stage, there will be the doshas which are in prasaravastha will be going. Dushyas are there already. So dosha dusha sammursanam will be happening. This is the stage of sthana samsraya. Usually it can be considered as the purva rubhavastha. For each roga, we are studying the purva rubhavastha. So this is the stage of sthana samsraya. If it is the doshas are localized in udara area, there may be vishujika or adisara as disease. So in this particular stage, premonitory symptoms that only I told, that is purva rubhavastha or of diseases are seen. So here we can see if dosha dusha samursana is happening in different areas. Few examples are given. If they are undergoing the sthana samsraya in udara area, which diseases can be manifested? Nothing but gulma, vidradi, udara, agni, vigaras, vibandha, pravahiga, etc. If the doshas are undergoing sthana samsraya in vasti area, it can cause the happening or occurrence of prameha, ashmari, mutra gada, mutra dosha. If they are undergoing sthana samsraya in medra, there will be ubadamsha, shuga dosha, etc. If sthana samsraya is happening in guda, bagandhara and arsha may occur. If they are undergoing sthana samsraya in vrishana area, vriddhi happens. On the other hand, if they are undergoing sthana samsraya in urdhva jatrugada, all type of urdhva jatrugada vigaras may happen. Coming to Toggada, all type of Kushta, Visarpa, Kshudra Yogas may be manifested. If they are undergoing Sthana Samsraya in Medas, Grandhi, Abaji, Arbuda, Galaganda, etc. If doshas are localizing in Asti areas, Asti Vidradi, if they are undergoing Sthana Samsraya in Pada, Sleepada, Vada Shonida, etc. Sarvanga Gada, if they are localizing, concentrating in all the areas, this may manifest as Jwara, Vadavyadi, Prameha, Pandu, etc. This is the Vyaktavastha. This is full manifestation of disease. Here all the, Sthana Samsrayavastha, if it is Purva Rubhavastha, Vyaktavastha is clearly Rubhavastha, stage of manifestation. This is derived as Vyaktihi Vyadhya Abhivyaktihi, as per Shabdakosha. So this here the stage of all clear-cut symptoms of disease will happen. This is considered as Vyadhi Darshana Avastha. So cardinal signs and symptoms of disease are expressed in this stage. For example, in the case of Jwara, Sandabam, increased temperature, and in Adisara, Maladhisaranam, excessive passing of watery stools, whereas in Udara Roga, enlargement of abdomen, clear-cut symptoms will be there. So Vyakti, as per few acharyas, it is of two types: Vyadhya Arambaga Dosha Lingavadi and Pradisvikti Vyakta Vyadhi Lingavadi. So in the first one, the manifestation of dosha which caused the disease is happening, whereas in the second category, separate manifestation corresponding to the disease process is happening. And always management, pure correct treatment protocol will be happening in this stage only, because this full clear cut symptoms will be manifested. So for a physician it is very easy to treat the disease, and management chikitsa is pratyaniga to disease also. Coming to last one, that is bhedavastha, that is the stage of complication. This is derived as vadadi lakshana bhedadi bhinnatvam bhedaha. That is why different complications or somewhat different aspects will be shown by the diseases. For example, In the case of Vranas, in Bhedavastha, they may burst and become ulcers. And some disease may attain chronicity also. For example, in the case of Jwara, Navajwara Avastha will be changed and the Jwara will be converted into Jirna Avastha. In the case of Amavada, Pravruddha Amavada. And in this stage, specific signs and symptoms of the disease manifest like Vadaja, Pittaja. That is also considered as Bhedavastha, depending on the chronicity of the disease. And this particular stage of manifestation is very difficult to cure. So complications may also occur, that is Ubhadrava also may occur. So it will be somewhat difficult to treat the disease. Better to treat or complete the treatment protocol in the Vyaktavastha itself. Or what will happen in Bhedavastha, this may become Yapya Roga or Asadhya Roga also. That complication will be there. So why this much importance is given to Shatkriya Kala? The first point is Nidana Parivarjanam. We very well know Nidana Parivarjanam is the Chigilsa itself. If we know to avoid the causative factors, Nidana Parivarjanam, then we can prevent the occurrence of any disease. So this will help. Knowledge of Shatkriya Kala will help to arrest the pathogenesis in the early stage itself. As I told, in Sanjayavastha itself, it can be treated. And it gives an idea of prognosis of the disease, prophylactic treatment and curative treatment also. And the treatment also will be easier if the disease is diagnosed in the earlier stages. That is not only for our science, even for other branches of medical sciences, it is easy to diagnose in the earlier stage. When the doshas are controlled in the Sanjaya stage of Kriyakala, obviously Chaya eva jaye dosham, that is told by Vagbada, then they cannot proceed further into the consequent stages of Kriyakala. However, if the doshas are ignored, they will proceed further, obviously. These doshas are always having that tendency. That is why the derivation itself is dushayanti di doshaha. And this will try to vitiate others also. So it will be more strong and deep-rooted. And there will be resistance to medications also. So by understanding Kriyakalas, treatment should be done in the earliest possible stage. And knowledge about Sanjaya and Achaya Pragopa helps in the selection of proper treatment procedures in the Pragopa stage of Kriyakala. For example, Shodhana is the treatment of choice for Apatya Nimittaja Sajaya Pragopa. But in case of Ajaya Pragopa, Shamana treatment is recommended. So that is also told. Where in Apatya Nimittaja Sajaya Pragopa, there will Shodhana should be opted, whereas in other case, Shamana treatment should be done. And always Chigilsa is nothing but Samprapti Vighadanam, that we very well know. So treatment and Shatkriya Kala collectively called as Samprapti. Samprapti or pathogenesis of disease is nothing but the proper Chigilsa and knowledge of Shatkriya Kalas, where to apply which type of treatment. If we know that very well, Samprapti Vigadanam will happen, and Samprapti Vigadanam itself is the Chigilsa. Okay, so the sequence of Kriyakalas should be broken down by applying treatment in the earliest possible stage. To attain success in treatment, it is essential to apply proper measures, starting from Sanjaya stage itself, that is accumulation stage of disease. So all stages of Kriyakala require action by a physician. That is why these 6 stages are called 6 stages of action, Shat Kriya Kala. Okay. So these 6 Kriya Kalas can be very well connected with Panja Nidanas also. That is Nidana, Purva Rupa, Lakshana or Rupa, Ubashaya and Samprapti. For example, Sanjaya, Pragopa and Prasara can be correlated with Nidana stage, that is Hedu among the Panchanidanas, Sthana Samsraya with Purva Rubhavastha, and Vyakti Bheda with Rupa Ubashaya. Like that, we can just have a correlation. And these Shatkriya Kalas also give a light to the Sadhya, Sadhyada or prognosis of the disease also. Because in Bheda Avastha, as I told, it will be going to the complication stage. So the disease may become Asadhya or Yapya. And Kriyakala also helps to find out the appropriate time for doing surgery. In Shastra, that is why Susruta has explained more about Shatkriya because to give proper treatment in the Shastra Sadhya diseases, especially Vrana like that. So Kriyakala knowledge will help to give the correct treatment protocol in Shastra Sadhya diseases. Timely intervention with appropriate Aushadha, Pathya and Vyayama also will help to do the treatment properly. Both the short-term and long-term complications can be effectively managed and prevented by breaking the vicious cycle of pathology, samprapti, and thereby enhance the quality of life of the patient. So this is the treatment plan according to Shatkriya Kala. Uh, s- uh, Under dosha pratyaniga chikitsa, the first three factors of Kriya Kala can be considered as Sanjaya, Pragopa and Prasara. Whereas under Vyadhi pratyaniga chikitsa, Vyaktavastha and Bhedavastha, and Sthana Samsraya is the middle factor, that is Ubhaya pratyaniga chikitsa. Like that, we can plan the treatment. So measures for maintenance of homeostasis. So how these Kriya Kalas will help in maintaining homeostasis, that we will see. So the first three stages will help in the lifestyle and dietary modification. Prasaravastha, that is in that stage, Sthaniga dosha chikitsa can be given. For example, if Vada encroaches Pitta sthana, first Pitta should be managed because Vada is the ultimate factor which will carry all the doshas, as I told. So there, wherever Vada goes, that area should be taken care. If the Pitta encroaches Kabasthana, Kaba should be managed. And if Kaba encroaches Vadasthana, Vada. So whichever dosha is encroaching the other dosha sthana, that should be taken care. Treatment according to disease, Rasayana, Shodhana, Shamana, Shastra Chikitsa, everything depend upon the advancement of the disease. So we can explain the Kriya Kala in view of other sciences also. For example, if we try to explain diabetes mellitus, each stage of that disease can be explained with the help of Shatkriya Kala. For example, the predisposing factors like genetic or presence of diseases like obesity, for them there are the chances of occurrence of diabetes mellitus. So these PCOS or sedentary lifestyle, more intake of fatty food, everything can be considered under Sanjaya Avastha because that is the stage of accumulation. No, under Pragoba Avastha, augmented hepatic glucose production, decreased insulin mediated glucose transport, and impaired beta cell function. All these can be considered under Pragoba. Whereas hyperlipidemia, hypercholesteremia, impaired renal functions, everything can be correlated with Prasaravastha. Then impaired insulin mediated glucose transport in muscle and adipose tissue can be considered an impaired glucose level with Sthana Samsraya Avastha. And obviously polyuria, polydipsia and polyphagia, which are the cardinal symptoms of diabetes mellitus under Vyakta Avastha. And all the complications of diabetes like retinopathy, nephropathy, ketoacidosis, heat stroke, multiple organ failure can be considered under Bhedavastha. Like this, each disease from modern explanation can be explained under Kriyakala. So this explained till now I have explained about the Vyadhi Kriyakala. Coming to Ritu Kriyakala, this is explained by Chaya, Prakopa and Prashama by Vagbhada. Seasonal variation of dosha occurs in respective seasons, like what we have explained. I have explained before, like Chaya Prakopa, Prashamaha, Vayor, Grishmadishu, Trishu, Varshadishu, Chapitasya. For each dosha, depending on the seasons, seasonal variation will happen that we cannot prevent, but we can manage by taking proper diet and doing proper exercises, ahara vihara. By knowing or by the intake of proper ahara and proper lifestyle, we can minimize the seasonal chaya, pragoba, prashama happening for the tridoshas. So Vagbhada describes Rudu Kala along with dosha chaya. Increase of dosha in its own place and manifest dislike for things which are I have explained this chayo vriddhihi swadhamnyeva pradvesho vriddhihedushu. There will be dvesham for vriddhihedus. So like that we can identify the chayavastha. So we can avoid taking such foodstuffs. Then the dosha chaya will be controlled. Whereas koba is spreading of this dosha to different places and manifestation of symptoms. Like vada we have already we know already karshya karshna ushna kamitva kambanaha sagridgrahan balanidrendriya brahmsha pralaba brahmadinadaha for vada. Like that for pitta and kaba lakshanas are told. These all are coming under kobhavastha. So in this stage, patient may feel ill health and disease may manifest if not taken care. At this stage, it will again complicated. It will become more complicated, and premonitory signs and symptoms also will happen. So doshas attain normalcy. So in third stage, that is prashama avastha, it will attain normalcy after proper treatment or automatically also because this is happening. This is Ritu Kriya Kala. No, so after the influence of particular Ritu, automatically or even the next Ritu comes. For example, in the case of Vada, Chaya Pragoba Prashamaha, Vayor Grishmadishu Trishu. In Grishma Ritu, Chaya is happening. In Varsha Ritu Pragoba, and in next Ritu, that is Sharad Ritu, automatically it will come to Shamavastha. Okay. So this is the explanation for that particular reference. Here also, imbalance of tridosha can be correlated with the imbalance in the ratio of see, we have particular set of concepts, whereas modern medical science, they are also having their own basic principles. So our Kshatriya Kala concept can be correlated with their basic principles also. For example, the Sanjay Avastha may represent the level of oxidative stress which damages the cell structure and its functions. Okay, that is the first stage of starting of disease. So such phenomena may induce somatic mutations and neoplastic transformation. Whereas Pragoba stage has unusual cell proliferation due to oxidative stress which may increase the DNA mutations. In the case of Prasara, this we can correlate as cell migration. And in the disease of cancer or tumor, the concept of Shatkriya Kala can be correlated. Like diabetes, how we have seen. So, in the use, diagnosis and treatment of cancer in early stage can be more effective for patients. So, here also, before the happening of complication, if we start the treatment, more results will be there. So this is the hypothetical model for of Shatkriya Kala to assess cancer. That is Sanjaya, that is the predisposition stage. pragoba, diagnosis stage, and treatment aspect as prasara, then sthana samsraya as prognosis, and vikti as monitoring, and bheda as disease outcome. So, due to various factors, the doshas in the body undergo vitiation or morbid changes may initiate the process of disease manifestation. So, we should be thorough with the provocating or pragopa karanas of each doshas. Then we should know about the kriya kalas. So, by knowing the provoking factors, provoking causative factors, and the concept of kriya kala, we can easily diagnose the disease, and easily we can start the treatment also. So the good knowledge of concept of kriya kala is very essential for the disease procedure. If the deranged doshas are left unrecognized and untreated, this will gain strength for further development. The diseases manifested in a particular stage of Kriyakala may even precipitate some other diseases, which are called as Nidanarthakara Rogas. If the diseases are not properly treated in these 6 Kriyakalas, this may happen in Nidanarthakara Rogas. So, to conclude, the proper knowledge of Shatkriya Kala helps in understanding the process of manifestation of various diseases and in diagnosis also. The physician who diagnose a disease and treat accurately according to Shatkriya Kalas can become a successful practitioner. If he knows from the Sanchaya Avastha itself, he can very well manage the disease. The knowledge of health Shatkriya Kala is helpful for knowing the sadhya sadhyata of diseases and also plays important role in the treatment. So these are the references. Thank you once again for giving me this chance.
थैंक यू मैडम.
Thank
हेलो.
you. Thank you.
हाँ, थैंक यू मैडम. आदरणीय उपस्थित सभी विद्वज्जनों, आयुर्वेद प्रेमियों, शिक्षकगण, विद्यार्थियों एवं सभी श्रोताओं, आज आरोग्य भारती पश्चिम महाराष्ट्र प्रांत के भारतीय स्वास्थ्य चिंतन आयाम एवं भागीरथी मेडिकल फाउंडेशन द्वारा आयोजित नेशनल लेवल ऑनलाइन लेक्चर सीरीज के 31वें सत्र में हम सभी ने अत्यंत ज्ञानवर्धक एवं प्रेरणादायी व्याख्यान का लाभ प्राप्त किया. क्लिनिकल सिग्निफिकेंस ऑफ क्रियाकल्प एज अ फ्रेमवर्क फॉर टाइमली थेरापेटिक इंटरवेंशन. इस महत्वपूर्ण विषय पर आदरणीय डॉक्टर रोशनी जी मैडम ने अत्यंत सरल, वैज्ञानिक एवं व्यवहारिक शैली दैट इज मॉडर्न कोरिलेशन के साथ हमें मार्गदर्शन प्रदान किया. उनके अमूल्य विचारों से हम सभी निश्चित रूप से लाभान्वित हुए हैं. इसके लिए मैं उनका हृदय से आभार व्यक्त करती हूँ. अब हम कार्यक्रम के प्रश्नोत्तर सत्र की ओर बढ़ते हैं. यदि किसी स्टूडेंट को, फैकल्टी को इस विषय संबंधित कोई प्रश्न पूछना हो तो कृपया आप आपका माइक अनम्यूट करके पूछ सकते हैं या प्रश्न चैट बॉक्स में लिख सकते हैं. एनी क्वेश्चंस?
Uh, there are some opinions in the chat box. You can read it. Dr. Divya ma'am, please.
यस 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 सर. हेलो सर, आई गेस इट इज नॉट विजिबल हियर. Yes, there is one opinion from Professor Vaidya Yogita madam. Am I audible, sir? Hello.
Yes, you are audible.
Yes.
Continue.
Yes. So, madam has mentioned Sanchaya Prakop Prasar Avastha is not Avyakta Avastha. Confirmation of disease is not completed in this Avastha. If you identify this Avastha, you may proceed for medication. This is opinion from Professor Vaidya Yogita Madam ji. Madam. May I request Roshni Madam ji to please put light on this point? Madam. Ma'am, I guess your mic is muted. Kindly unmute it. डॉक्टर रोशनी मैडम, आपका माइक म्यूट है.
Ma'am, unmute yourself.
Yes,
Now,
ma'am.
now it's clear.
Yes, ma'am. It is clear now.
Because why I told like that, because first stage Sanjaya Avastha, it is starting stage where the symptoms will not be clear. In Prakopa Avastha also, it will not be that much manifested the symptoms. In Sthana Samsraya Avastha, only the prodromal or Purvarupa Lakshanas will be seen. That is why the first three stages are explained as preclinical stages. Whereas after Sthana Samsraya, in Vyakti, Vyaktavastha, this will be clearly manifested. So the last three are considered as clinical stage also.
Yes, ma'am. Ma'am, I guess it is clear now. अत्यंत सरल शैली में आपने समाधानकारक उत्तर देने हेतु मैं फिर से एक बार डॉक्टर रोशनी मैडम जी का पुनः अभिनंदन करती हूँ. अब हम कार्यक्रम के समापन हेतु आदरणीय वैद्य संतोष जी गटने सर जी का संक्षिप्त परिचय प्रस्तुत करना चाहूंगी. वैद्य संतोष जी गटने सर जी, सर आरोग्य भारती पश्चिम महाराष्ट्र प्रांत के सचिव के रूप में निरंतर आयुर्वेद एवं भारतीय स्वास्थ्य परंपरा के प्रचार प्रसार हेतु समर्पित भाव से कार्यरत है. आप महाराष्ट्र आरोग्य विज्ञान विद्यापीठ नासिक के सीनेट सदस्य तथा स्थायी समिति सदस्य के रूप से भी महत्वपूर्ण दायित्वों का निर्वहन कर रहे हैं. इसके साथ ही आप एक अनुभवी आयुर्वेद चिकित्सक एवं आयुर्वेद औषध निर्माता के रूप में समाज सेवा एवं आयुर्वेद चिकित्सा क्षेत्र में उल्लेखनीय योगदान दे रहे हैं. आदरणीय गटने जी सर जी को मैं विनम्र निवेदन करती हूँ कि वे अपने समारोह एवं मार्गदर्शक विचारों द्वारा हम सभी का मार्गदर्शन करें.
Thank you, Dr. Divya Patil. Thank you, Dr. Roshni, for your very useful lecture. This lecture will be remembered for a very big period. All students and practitioners can listen this lecture on YouTube when it will be uploaded on the platform. I remember my teacher who taught me that practitioner should remember at every time that what not to do. I think that by saying that, he suggested to study the kala of that Vyadhi. I have seen my teacher very angry and very sad when the patient, which was uncurable or asadhya, Bedavastha, when these patients came to him, I have seen him very sad and very angry. He always driven of these patients in anger. But that was not the anger, but that was a compassion. At this time, I want to request all the students, all the practitioners to see this compassion and accept this compassion and to treat the patient with compassion. The best quality of every practitioner should be he should have a compassion in his heart. With this request, I conclude my speech today. Thanks.
थैंक यू सर जी, थैंक यू फॉर योर वैल्यूएबल इंसाइट्स। आपके प्रेरणादायी एवं मार्गदर्शक शब्द हम सभी के लिए अत्यंत प्रेरक है। आज के इस राष्ट्रीय स्तर के ऑनलाइन व्याख्यानमाला कार्यक्रम को सफल बनाने में प्रत्यक्ष एवं अप्रत्यक्ष रूप से योगदान देने वाले सभी मान्यवरों के प्रति मैं हृदयपूर्वक आभार व्यक्त करती हूँ। सर्वप्रथम आज के उद्घाटक एवं मार्गदर्शक आदरणीय डॉक्टर TN मंजुनाथ जी सर जी का हार्दिक धन्यवाद। आज की मुख्य वक्ता आदरणीय डॉक्टर रोशनी जी मैडम जी का विशेष आभार, जिन्होंने अपने गहन अध्ययन एवं अनुभव से विषय को अत्यंत प्रभावी रूप से प्रस्तुत किया। साथ ही कार्यक्रम के प्रमुख आदरणीय डॉक्टर मनोज चौधरी जी सर जी का, वैद्य संतोष जी कटने सर जी का, आरोग्य भारती पश्चिम महाराष्ट्र प्रांत भारतीय स्वास्थ्य चिंतन आयोग भागीरथी मेडिकल फाउंडेशन एवं सभी आयोजकों, सहभागियों तथा उपस्थित सभी श्रोताओं का मनपूर्वक धन्यवाद। आप सभी के सहयोग एवं सहभागिता से आज का कार्यक्रम सफलतापूर्वक संपन्न हुआ। अब हम कार्यक्रम के औपचारिक समापन पर सभी मिलकर शांति मंत्र का उच्चारण करेंगे। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। धन्यवाद।